Hi, my name is Jessica, and I've been coming to Dr. Barrett-Wall's office for SRA treatments. Since receiving my first treatment, I have noticed a difference in any active acne that I've had on my face, and I haven't had any new breakouts since then. I have a very fair complexion, so sun damage and freckling are definitely a major concern of mine, and since I had my first treatment, I've actually noticed an improvement in both. I'm really happy that I came to Dr. Barrett-Wall's office, as he's one of the only physicians in the LA area that actually offer this type of IPL procedure. And it's safe to say that I will definitely never do a basic IPL again. Dr. Bob is very caring, his clinic is beautiful, his staff are so welcoming, and Dr. Bob definitely has me as a loyal patient for all of my future cosmetic needs.
Hello, I'm Dr. Barrett-Wall, Medical Director of Vitale MD Medical Aesthetics and Dr. Barrett-Wall Aesthetics. We're here today with one of our lovely patients, Jessica. Welcome, Jessica.
Thank you.
Jessica is actually a patient of ours who's received several treatments in the past for her active acne using the SRA technology. And so, Jessica, you're here today to look at those problematic areas, is that right? Now, what does the SRA treatment stand for? Skin rejuvenation or skin rejuvenation advanced. More commonly known to many patients as a photofacial, but it's actually not the typical photofacial. A regular photofacial, or IPL, refers to intense pulse light. The radiofrequency and intense pulse light combined technologies are what make the Syneron SRA treatment different from a traditional IPL photofacial. It also helps us get deeper penetration into hyperpigmented areas, to areas that normally we couldn't reach due to surface skin damage and patient intolerance with a traditional IPL photofacial. For most patients, the treatment is relatively painless. The SRA treatment is wonderful for several conditions such as hyperpigmented spots, melasma, rosacea, and just general the contour and complexion and texture of the face. It helps to improve it. SRA treatment is also wonderful at helping treat active and ongoing acne. As we know with acne, our sebaceous glands that surround our hair follicles can sometimes get clogged with excessive oils or dead skin. When that happens, bacteria enters into that area and grows and creates active acne, which causes inflammation. That the SRA treatment, again, uses the bipolar radiofrequency plus the intense pulse light, laser, and destroys that active acne, helping treat the acne lesions and helps reduce redness and improve healing. So today we're going to go ahead and get started. Are you ready, Jessica?
I'm ready.
Great. And we're back again. So we've prepped Jessica's skin with a cool conductive gel. Because we are using radiofrequency, we do need a conductive gel medium. And we also need to ensure that the patient's eyes are protected against the radiofrequency and intense pulse light. So Jessica, let's go ahead and have you sit back for me. Excellent. How does that feel? You can go ahead and adjust it for me. Wonderful. We are going to use the SRA head, which also has a cooling device, which also not only provides comfort to the patient while receiving the treatment, it also facilitates the penetration of the radiofrequency waves into the deep dermal layers. And we often let the patient know we're going to do a little test spot first. So Jessica, you're going to feel a little pinch here. 1, 2, 3. How did that feel?
Not too bad.
Okay. So we stop, we look, and watch her skin to make sure that there is any erythema, which is normal, that it does calm down before we continue. If not, we can adjust the settings based on that. We don't want to be too conservative. We do like to be conservative in the beginning, but we like to also give the patients the benefit of the maximum treatment that they can tolerate so they can get maximum results. So the skin looks very nice. Let's turn your chin just a little bit for me, please. So the hyperemia just was reduced right away. So based on the patient's tolerance, we'll proceed. 1, 2, 3. And as we walk down the skin, on her cheek, there's a cooling effect from the head that we leave on her face. And we divide it into sections. So as we proceed, you'll see the erythema in the affected areas. So you can see, maybe turn your head, Jessica, for us, please. You see a little bit of erythema there, And that's natural and that's normal. That's what we'd like to see. So we know that we're really getting into the deeper hyperpigmented areas and to the sebaceous oil glands. And if you can purse your lips for me, please. Excellent. I'm going to get right to where that active acne is and make firm contact and really get at that, those areas that are troublesome for Jessica and for most patients who have acne, adult acne. Turn your head for me, please. So now we're going to begin on the other side for our first pass, and we'll come back and do a second pass. You're getting a great reaction here. As with all our patients that get laser treatments, we do offer complimentary topical anesthetic to the skin, but Jessica's pretty stoic, pretty tough, and so she's doing great. And again, this treatment, very little discomfort. And so we can bring your head straight, right midline there. And so you can see already, we've got erythema that's quite red here, and now if we look onto the other side, we can see the erythema is now cooling down. So we can see that those dark pigmented areas are being affected. We're getting into the sebaceous glands around the hair follicles, zapping that acne, and she's going to get, I think, a wonderful result. So we're going to take a second pass now. Okay. Again, we're going to go over the chin, the problematic area. Okay, let me turn your camera this way, please. And get around the nose here. And we've done 2 passes, and we're done. How do you feel, Jessica?
Pretty good.
And any discomfort?
Not really.
Okay, so a very great effect with very little discomfort, little downtime as we remove the goggles here. And what we normally ask patients to do after we're done is that we will apply a little bit of hydrocortisone cream if there's any irritation or burning. We let patients know they're able to do that at home as well. We also encourage patients to use sunscreen, SPF 30 or higher. Here we also carry the Vitalia MD medical skincare line, which includes our green tea sunscreen, which has SPF 50. And we apply that to the patient's face just as a protective layer, and we always tell our patients to use sunscreen at least twice a day after having this treatment. And it's not uncommon after having this treatment that the patients may see little coffee ground black spots on their skin. We tell them not to worry. That's actually a part of the healing process of this treatment, that the hyperpigmented or dark spots that are deep within the dermal layer are being brought up to the surface and being shed off, and they can just lightly exfoliate and those black spots will disappear, and that's an improvement actually in their skin. So we tell the patients that's how we know that this technology is working. For the actinic area here, of course, the patients will see a decrease in the redness and also the improved healing process. So the recovery time for back to her regular skin will be expedited. So now we've finished with the treatment. For post-treatment care, we're going to use the Vitalia MD Medical Aesthetics Recovery Ointment. So we're going to just apply a very thin layer, just so that sometimes the patients have a little bit of erythema before they leave, or a little bit of irritation. So just a very mild layer that helps soothe and calm the skin down. And then we also recommend that patients use sunscreen, and we use our Vitalia MD Medical Aesthetics Green Tea Advanced Anti-Photoaging Sunscreen. So it's got a little bit of a tint to it. Women like that. They don't have to put on foundation after this treatment. However, they can go ahead and go back to the gym and their regular activities. They can wear makeup if they wish. We ask them to try to hold off on using makeup for the first day, and then they can go back to the regular makeup the next day, but they can, if they want to, the same day, apply makeup to the affected area. So, and that's it. Great. How do you feel?
Really good. Thank you.
Quite welcome.